We often hear from our patients from Russia that for those who come to the oncology department, there are still no chances. This does not correspond to reality. For numerous patients, if they are prescribed the appropriate treatment, there is a possibility of achieving full recovery. So the illness will never come back again. Or they have the opportunity to significantly increase the duration and quality of their life in a way that can have a profound and lasting impact on their overall well-being and happiness. I often see patients' documents where they are simply informed that they have such and such a tumor and there is not much that can be done about it. And that is the entirety of it. It is simply not true in any way, shape or form. Patients come to us, for example, with stomach cancer, who were told that the only option was to remove the stomach, and whom we cured with combined therapy, immunotherapy, chemotherapy before the surgery itself, and post-operative treatment. Individuals of this nature have been availing our monitoring services for an extended period of time, spanning many years. When it comes to breast cancer, the molecular profiling of the patient holds significant importance. This profiling process aids in clarifying the required treatment and identifying the patient's risk group, thereby offering her a chance of recovery and improved prognosis. A tumor in the breast and metastases in the lymph nodes do not imply that it is impossible to cure. Even in such a circumstance, achieving full recovery is feasible. Thanks to the successful treatment, patients can lead a satisfying life and may also have the possibility of having children in the future years that lie ahead. Receiving chemotherapy treatment does not automatically indicate that a person is unable to have children in the future. Lymphoma is a classic example of those diseases that can ultimately result in death if patients are not properly provided with the necessary medical care. If patients are treated correctly, the disease can recede, and the likelihood of the disease not returning throughout their entire life ranges from 80 to 90%. I perpetually have a task in front of me at all times.
Every single patient should be carefully and thoroughly considered on an individual basis, taking into account their unique circumstances and needs.
And the cancer characteristics of each of them also need to be checked individually. In other words, the tumor is examined twice, once for each of them, to ensure thorough evaluation. We are examining her here with local pathologists, conducting additional tests to determine if there are specific molecular prerequisites for the patient's treatment. In this manner, we can comprehend if the patient requires chemotherapy or not. Some individuals may solely require medication. Not all of them need chemotherapy. Sometimes, while being with the patient, we tell them that with radiation therapy and surgery, they have better chances, so they don't need us at all. However, even this information should be conveyed to the patient only after they have been examined, their medical history has been reviewed, and additional molecular analyses have been considered. This implies that the notion that life is regarded as lost after the commencement of cancer is entirely and unequivocally erroneous and does not align with the reality of the situation. We need to make an effort, examine the patient, and even if patients come to us with metastases, it should not necessarily imply that they will die as a result of it. We have patients undergoing multimodal therapy, after which they live for a prolonged period of time with metastatic formations. At present, there is a female patient behind the door who had colon cancer with metastases in the liver. For the past 5 years, she has been coming to our clinic because with the help of advanced treatment methods such as immunotherapy, chemotherapy, as well as transarterial chemoembolisation of the liver metastases surgery by our surgical center, and the assistance of our gastroenterologists. We have contributed to the fact that the patient, who was supposed to live only 6 months without medical intervention, now comes to us for a follow-up examination in the 5th year. The woman is now 83 years old. Thus, we witness accounts of patients afflicted with diseases that are commonly regarded as hopeless, but who have the potential to experience an extended period of high-quality life if a meticulously crafted and individualized treatment strategy is developed and implemented for their unique circumstances and needs. The same is applicable to aggressive hematologic conditions. For instance, acute leukemia is no longer regarded as a disease that results in mortality. Aggressive non-Hodgkin's lymphomas can be cured. Today, the chances of curing this disease in our clinic are quite high. The rate of cure can vary significantly, ranging from 70 to 90%, depending on the specific type of non-Hodgkin's lymphoma that it is. The crucial thing is that the treatment should commence promptly and adhere to the most up-to-date medical guidelines. This is the precise aspect that we deem highly significant.